Wade Miller is a U.S. Marine senior advisor at the Center for Renewing America, and he joins us now. Sir, good to have you on the show.
Thanks for having me on.
The challenges at the VA we routinely hear are pretty immense, and they continue to this day. Lots of problems for people being able to even gain access to the VA, getting the runaround. How do you assess it right now?
Big problems. The first Trump administration moved in the right direction. They really worked with Congress on the Mission Act, which was, a really important piece of legislation to reduce the need for veterans to use VA-specific hospitals so they could use community hospitals nearer them. And, of course, the Biden administration walked that back, and it put more of a focus on making veterans have to use VA hospitals. So there's all sorts of efficiencies that can be found just by going back to the first Trump administration policies and really reinforcing the Mission Act and putting resources to that program, because then all of a sudden it reduces the reliance and need of VA facilities and staff. It's an easy efficiency just right there that can be had, and it's already in law.
And that one in particular, just thinking it through, I can think of two big reasons why that's important. One, you decrease wait times because you're not overwhelming one facility. And then two, you don't require veterans to travel, perhaps in some cases hours, just to get to their appointment. They can go to something much closer to them.
That's exactly right. When I moved to D.C., I'm a VA patient. I re-enrolled in Dallas. I had one about 10 minutes away. I moved to D.C. The one near me was full, so they enrolled me in one that was over an hour away, and that's without traffic. And everyone who's in D.C. knows that you never don't have traffic. Right. So it was just I never used the VA. I paid out of pocket because it was such an inconvenience. It's just not an effective and efficient system. There's better ways. And if you think about it, we've got Medicaid, we've got Medicare programs. You don't build an entirely new medical system just to serve those people. It works within the existing hospital frameworks within the nation. We already have a hospital system. It makes no sense for us to create a specific carved out resource, because you're right, it increases wait times. I've had examples in my past where I had to wait months and months and months to get an MRI or an EMG, when I could have just gone down the road and gotten it within a week at a private hospital system. It just doesn't make any sense, and I'm really excited that Doug Collins and his team are there to fix this problem.
So when they say they're going to reduce the workforce by 15%, you heard Doug Collins just lay out that they have about 470,000 employees right now. They want to trim it down to just a little bit under 400,000, putting them back actually in the Trump era strength of the workforce size. It would be around it was 2019 when it was last that size. Do every one of these employees serve some sort of care-based purpose for veterans, or is there a lot of fat at this agency?
No, there's a huge amount of bureaucracy. I'd like to see a study out there that's commissioned, like how many VA employees are actually just nurses and or doctors or primary health care, therapists that, for PTSD. My guess is that the number is shockingly high, as is every bureaucracy in the government. Very few of those people who are employed actually serve the function and purpose of that agency. So there's plenty of rot here. We did a federal government-wide survey on DEI spending and funding. There's a huge DEI bureaucracy at the VA, that can be defunded just right there. That's an easy one. But there's so many bureaucracies that are redundant, unnecessary, or duplicative. At one point, I think there were 6 different veteran suicide programs. Why not figure out which one is the best and put all of our resources into that one? That's the kind of stuff that's been happening for decades.
There's a lot of waste there, it turns out. The VA Secretary Doug Collins pointing out earlier this week, they've looked through the contracts and they're finding all sorts of garbage. Take a listen to this. Let's see here. Stand by.
Here's just one example. We're conducting a comprehensive review of the VA's 90,000 contracts, which are worth more than $67 billion. After reviewing roughly 2% of those contracts, we were able to cancel nearly 600 non-mission critical or duplicative agreements that will save the department roughly $900 million.
Well, that's a pretty good return. So just looking at 2% of the contracts that the VA has, they're saving nearly $1 billion already, Wade Miller.
That's right. And this has been institutionalized through Congress for decades. where if you propose spending money at the VA on something or issue a contract, you're pro-veteran. And if you try to cut it, you're anti-veteran. And so it just builds on itself to where you have all of this waste and abuse and fraud and duplicativeness. So you really have to have a team that is ready to face that onslaught of, name calling and claiming that they're anti-veteran, when in reality, that's, as conservatives, we're just used to that. So like, run into oncoming traffic, understand they're going to call you names, do what you need to do to take care of veterans. And that's what they're doing right now.
Well, that's exactly right. And you see this in every other debate that we're having about government spending right now. You find out that on the Social Security rolls that people are listed as being hundreds of years old. Normal people say, well, why don't you clean up the Social Security rolls? The left says, don't you dare touch Social Security. They're acting as if you're cutting benefits for seniors. The same is true of Medicare and Medicaid, where you're looking at over $100 billion in fraud estimated each and every year. You say, we got to clean up that fraud. They say, you are going to strip away Medicare for seniors. You're going to strip away Medicaid for needy Americans. They just lie about what's actually going on. And these are agencies that are desperately in need of efficiency reform.
That's right. And I think that the new team here is committed to that vision, and everything I've seen so far vindicates that viewpoint. And it's just going to get worse. The closer they get to solving this problem and actually improving veteran health care, the more the left will call names, because they realize that if we can spend far less, make the system far better, and improve health care for veterans, it's going to be a real black eye for the left on all of this nonsense that they've been piling on all the wasteful spending that they've been pushing forward in the name of helping veterans while not really doing that at all.
Yeah, not at all. All right, Wade Miller, you're a great veteran, Marine, senior advisor at the Center for Renewing America. Sir, thank you very much for your time today.